waste no time heading out to North Carolina, where officials from the North Carolina Department of Health and Human Services are speaking about cyclosporiasis. Let's listen in now.
Good afternoon. This is Anita McMullen, Division Director for the Food and Drug Protection Division with the North Carolina Department of Agriculture and Consumer Services. At this time, we are not conducting any testing of lettuce products related to the cyclosporiasis outbreak.
Thank you. We'll go to our next question from the chat from Univision. They say North Carolina has now reported 561 cases, and you've mentioned this outbreak does not appear to be linked to the National Taco Bell and/or Taylor Farms investigation. So what is your leading hypothesis about the source of the outbreak here in North Carolina?
That is a great question. What we know from dealing with cyclosporiasis, it's been reportable in the United States since 1998. Of course, the first big outbreak was identified in 1996 and then fully characterized in 97 and 98. And that was raspberries from Guatemala that were the driving force behind that outbreak. But what we've learned over the years is that there are many fresh fruits and vegetables which can serve as vehicles for cyclospora. So our thought is that it's likely, maybe probable, that there are multiple vehicles for cyclospora. It's not a single source or a single food product from a single company. I think in Michigan, they were able to identify that a significant proportion were associated with Taco Bell and lettuce, but not all of them. And that's true in other states as well, including North Carolina. There are certain foods that we believe are implicated based on the frequency with which they appear during our interviews, but it's likely more than one.
We'll go to another question from
Thank you so much.
We'll go to another question from the chat. Aside from the 350 cases in the Wake County area, is there another county or region with a major confirmed case count?
The cases are distributed across the state, but you're right, there's a heavy number of them in Wake County. But we really don't see any other counties that have a significant burden, but they really do range from out west to the coastal region. So they're appearing across the state geographically, but in the other counties in lower numbers, obviously, than Wake. So no, we don't see a specific county of interest like Wake is.
We also received a question asking, does NCDHHS do their own testing or is this outsourced? And if it is outsourced, to whom?
So like many infectious diseases, there are commercially available tests. So when an individual seeks medical care with their provider, if they're tested for acute gastroenteritis, they might be looking for possible causes of that, which could be salmonella or cryptosporidium or cyclosporiasis. They'll oftentimes collect a specimen, send it to a commercial lab like Quest or LabCorp, who then runs the test for cryptosporidiosis. And that is in fact, cyclosporiasis, I misspoke. But that is in fact how we receive our notification of these cases, is when they're identified at a commercial laboratory, they send us an electronic lab report, which is another component of the public health system, as we receive a lot of the lab reports through that ELR system. In fact, I would say the vast majority of them.
We also received another question asking what treatment options are available in North Carolina, and can you share anything about antibiotics?
Yes, there are treatment options that are available and listed on the CDC website. And I would encourage anybody that needs treatment or needs that type of medical advice to talk to their primary care provider. But I would also say look at the CDC website for the definitive information on that type of treatment information and antibiotics.
Another question from the chat. DHHS said the most commonly reported source was lettuce, parsley, and cilantro. Is that still the case?
Yes, I should say, you know, when we do our food interviews, we ask people what they ate specifically, and if it's a menu item for a restaurant, we look at those ingredients and we call that an ingredient level analysis. And those items do pop up frequently. And that's not necessarily to say that that's proof that that's the cause, but it's one of those situations where if something keeps showing up repeatedly, a certain type of herb like parsley or cilantro, or a certain type of vegetable like lettuce, we start to think that that's probably implicated, or that may be implicated, and that's when we start collecting information on, you know, where was it purchased, and that we can share with our partners at NCDA for a possible trace back.
We'll go to one of our hands. Caleb, you can ask your question. I can see you're off mute, but we're unable to hear you. We'll come back in case you're having technical difficulties. I also see Evan Donovan had a question.
Yes, hi. So I just want to make sure I understand correctly. So we're saying that we've seen an 83% case jump in the past week, but we can't pinpoint exactly which products we think those are. We do think it's multiple. How does that change the advice that you would give people about how to keep themselves safe?
Yeah, it's difficult. We have obviously standard food safety messages that public health has used for, you know, decades, if not longer. And we tell people to cook their chicken to prevent illness with non-typhoidal salmonella, cook their hamburgers to prevent illness with Shiga toxin producing E. coli, right? Cook your pork, at least historically, to prevent illness with Trichinella spiralis. And that doesn't work as well with fresh fruits and vegetables because there's typically no kill step before you eat the food. So you don't generally cook your cilantro, but that will kill it, right? That will kill cyclospora. So what we're asking people to do is to, you know, think about what they're eating, take note of what they're eating. If you can avoid some of that, you know, that is a decision you could make. If you can cook your, you know, fruits and vegetables, like baking them or something like that, that is fine too. But we recognize that most people typically do not do that. So it's a difficult message to share because it's different than our classic methods of foodborne disease safety, which rely on a kill step.
We'll go to another question from the chat, from the News and Observer. I was curious, can someone get cyclosporiasis more than once? And if so, how might that reinfection occur and how common is it?
Well, they could. It seems to be pretty rare. People can become reinfected with a lot of things, and some things give you, you know, lifetime immunity, but cyclo is not one of them. We've not identified anything, to the best of my knowledge, or any situations where a person has been infected more than once, but it could happen.
They also asked, many people experience digestive issues or irregular bowel movements. Are there any other symptoms that particularly distinguish this from more routine gastrointestinal problems?
Yeah, this is oftentimes associated with diarrhea and bloating and fatigue. So it's similar to some other parasitic diseases like cryptosporidium. I think the best advice is if you're suffering from these ailments, we would encourage people to seek care at their medical provider because there could be non-infectious conditions too, and we don't want to jump to conclusions about somebody's health status based on, symptoms that can be fairly generic.
Our next question is from NC Newsline. With schools starting back in a few weeks, schools are having to make decisions about whether to serve lettuce and other fresh vegetables. Is DHHS offering any guidance?
Yes, we saw the news too about Durham County, and we are speaking with the Department of Public Instruction on this topic, but we don't have any specific guidance as of now.
One of our other questions in the chat is, do you have a hospitalization update beyond the 13 cited last Tuesday?
Yeah, I think we're up to 16 now that have been hospitalized.
We also have a question from WFMY News 2. While we know animals don't typically get sick in the way humans do from parasites, is it safe for viewers to give their pets foods that are commonly linked to this?
Yeah, humans are the only known reservoir for cyclospora. I'm not aware of any case reports of pets being infected, but I would say if you are concerned about it, I mean, maybe talk with your veterinarian. I can't really say. That'd probably be a good question for your veterinarian.
We also have another question in the chat asking, do we have an estimate on how long this would last?
The illness itself?
They did not specify, but I would say start there. Yes.
I think, it's variable, of course, but people can remain ill for, maybe a couple of weeks, but it depends on if you receive medical care or any interventions like that. I think it's highly variable.
We have a question from WXII. They asked, how has DHHS been able to rule out connections to other outbreaks in other regions of the US?
So that's a good question, because one of the things that we do at the health department is we like to collect clinical specimens that can go to the state public health lab. And if you're talking to more of the routine pathogens like salmonella or, salmonella is a good example. We do DNA fingerprinting, for lack of a better word. They call it whole genome sequencing. And again, that's done at the State Public Health Laboratory in Raleigh. And for cyclospora, you can do a similar thing, but you have to send the specimens to CDC for that. Most state public health labs cannot do the molecular work for cyclospora, but what CDC can then do is they can establish genetic linkages. If there's a similarity between specimens in North Carolina and, say, specimens in Oklahoma, then you can say, well, maybe there was a distribution of a common implicated food item. And that's something that the states work on. We try and get specimens submitted, as many as we can, to the CDC. They do that work, and then they can, in turn, can tell the states that there's a linkage here. Usually it's cases within a state. Sometimes it's state cases across states. And they put these together in what the CDC calls temporal genetic clusters, and lets you know that there might be a possible linkage between cases in various places.
Thank you. We also have a question asking, recent outbreaks have often been linked to fresh produce. Why is this commonly associated with produce, and what makes fruits and vegetables particularly vulnerable to this type of contamination?
Do you want me to try and take this, Anita, or would one of you like to speak about that?
Carl, you can start. We can jump in if we feel like we need to.
Okay. I think what investigators have found in the past is that, it's a human pathogen, so it's shed in feces that could contaminate surface water. And in the past, in other countries, that surface water may be used for irrigation, or it may be used for the application of pesticides. And that's how it gets from the human to the surface water onto the surface of the fresh fruit and vegetable. And again, these fresh fruits and vegetables, they come to the United States, they come to North Carolina. There's no outward sign of a problem. And again, because there's no kill step, there's no way to get rid of it, right? When you go to the grocery store and you buy your raw ground beef, you don't eat it that way. You cook it first because there could be Shigatoxin E. coli in there. Probably not, but there could be. There could be salmonella in the chicken, and you want to make sure you put an intervention in place to get rid of that. But there just isn't something like that for fresh fruits and vegetables.
Thank you. Do we have any other questions for the chat or any other hands?
I'm so sorry. This is Mike Stobie from the AP. I don't have a raise hand function or a chat room on my Zoom. Can I ask
Go
a
ahead.
question now?
Yes, go ahead.
Thanks, Mr. Williams. Could you say a little bit more about your question about how do we rule out connections to other outbreaks? You were explaining that CDC can establish genetic linkages, but then you trailed off. Are you saying you sent samples to the CDC and they said that there's no linkage? Thank you.
Yes, we're trying to send as many specimens as we can to the Centers for Disease Control. And we've sent a good number so far. I want to say it's several hundred, which is actually pretty good. And what they have found is we do have some temporogenetic clusters, but what they do is they link cases that we already knew about within North Carolina. Now, last year, for instance, we had some cases that were linked molecularly to cases in New York and Louisiana. So that allowed us to work, really allowed the CDC to work with those 3 states to try and narrow down, what could be a common vehicle that all of these people were exposed to. Because of the molecular relatedness, you would assume that there might be a common exposure there. The issue now, as you can imagine at CDC, is that they have got, the numbers are so much larger this year. They have a lot of specimens to go through, and I suspect there's a backlog and they're behind. So some of these things are going to take time. That molecular work is not quick. It's not something that can get turned around, in a day.
Thank you. We do have a few more questions coming into the chat. Can you share numbers from last year for comparison?
I don't have them at the top of my head, but they are on our website. But I want to say we had maybe 300 some cases last year at this time. So clearly more this year.
We have another question from Dewan Hoggard with WTVD. What's the best guidance you can give to North Carolinians, as there's a lot of information and misinformation out about what foods are safe to eat, depending on their origin?
Yeah, that's a great question. There's always a bit of perspective here. We have a lot of cases, obviously, of cyclosporiasis, with 560 as of now. But just for reference, we typically report over 3,000 cases of salmonella each year in the state, and over 3,000 cases of Campylobacter infection. So there's a lot of foodborne illness out there, and that's common across the United States. And with regards to cyclosporiasis in particular, I think we just recommend that people, what you do what you can do, which is to wash these foods thoroughly, even if they say they've been pre-washed. Now, that's no guarantee that you'll eliminate any cyclospora parasites that are on the food, but it's better than not doing it. So we recommend doing that, and also paying attention to the FDA food recall website. Because if there's any foods that have been recalled for any kind of reason, whether there's foreign material present or it's a bacterial pathogen, they'll put a notice up there, and then you know to avoid those foods. And usually the grocery stores and shops are very good at pulling those products off of the shelf. And that's something that, both our agriculture department and environmental health work on too, at the state and local level. So I'd say there's no guarantee, right? Except for cooking. If you cook it, you'll kill it. But most people don't want to cook their fresh fruits and vegetables. But we like to give the number of 165 degrees Fahrenheit. If you remember one number, like that's on the high side, but that'll kill any foodborne pathogens. So I think that's the best we can do.
Thank you. I see we have a couple more questions in the chat, and I know we're running short on time, so I will do my best to get to these questions for you all. The CDC has made changes to its disease surveillance and foodborne illness tracking programs. Have those changes affected North Carolina's ability to investigate this outbreak or identify its source?
And from our point of view, I don't know. I hear about that. I'm not sure what that specifically refers to, but CDC has been very responsive to us in the other states. They have a team working on this. They have weekly now, twice a week calls with the state health departments. And as with everything, they do the best they can. And I would say they're doing a good job helping the states at this point in time. But as you can imagine, I mean, it's a lot to go through.
Thank you. I think we have time for one or two more questions. Is this more dangerous for some segments of the population, such as the elderly or those with weakened immune systems?
Yes, I think with a lot of infectious diseases, that's true. And certainly you want to take extra care if you are immunocompromised or elderly. I mean, a lot of, even things that can be, relatively, I don't want to say benign, but not that big of a problem like salmonella. If you have a lot, you can get dehydrated with these, and that alone can create some serious problems. So we urge care with those groups that are more likely to be susceptible.
Thank you. And I believe we have a question from Grace Haba asking, is this considered an outbreak?
Yeah, I think that, in the general sense, it's above baseline, right? So you could say that it would be, a statewide outbreak like a lot of states are seeing. Usually we like to say we've got a source identified when we call something an outbreak, and we just don't have that yet. But clearly there are sources out there. But yeah, I think maybe it's semantics, but yeah, I think we're above baseline. So that speaks for itself.
And I believe we'll have time for maybe one more. WUNC asked, do you recommend people shop locally at North Carolina farms or farmers markets versus going to a chain, since the produce has been linked to farms outside of North Carolina?
Anita, do you want to take that one?
Yeah, sure thing. So I think it's really important to recognize that fruits and vegetables are an important part of a healthy diet. So maintaining access to those commodities is really important. I think this is also a wonderful time to visit some of our North Carolina farmers markets and take advantage of the great produce, fresh fruits and vegetables that we're selling now at our farmers markets. I think also buying at your grocery store, take a look at the source. Is it locally grown? Is it within the domestic US? Does it meet your criteria for a safe food product? I think those are all wonderful options to continue to keep fresh fruits and vegetables in your diet.
Thank you. For the sake of time, I believe that's all the questions we have time for today. Thank you all so much again for joining us and asking such thought-provoking questions. If we weren't able to get to your question, you're welcome to follow up with our press team. Otherwise, thank you so much for joining. Have a great day.
All right, welcome back to Live Impact News. A lot of good information in that Zoom. A very thorough review of cyclosporiasis and everything that's happening surrounding that parasite in North Carolina and more generally. A lot of good information there.